I want to switch topics, if I can, to the expansion of the Mexico City policy. I know that you and I disagree about women's reproductive rights, but I thought we agreed about the importance of ensuring that people could get access to health care. And yet, what we've seen from the expansion of this Mexico City policy, where we have reports about the impact, is a real negative impact on maternal health, on families. We have, according to the Marie Stopes International, they currently have a funding gap of $50 million as a direct result of this policy, and that translates to 1.4 million fewer women with access to contraception services, 600,000 more unsafe abortions, 4,600 avoidable maternal deaths. The Mozambican Association for Family Development will lose 60% of its budget next year. 10 of its 20 health clinics will close and 30% of its staff will be laid off. In Swaziland, the group has lost a quarter of its funding and as a result is now only able to serve 4 towns out of 14. In Botswana, 60% of funding is under threat. And while 1 clinic has already closed, 7 others have scaled back to a bare minimum. So in fact, despite some of the previous testimony that I've seen, the data is unmistakable. This is having a huge impact on the health of women and families around the world. And so I think we can all agree that we want to ensure that the United States policies support health care for people in this country, and yet this policy is undermining that for women. Can you justify why you think this is, in fact, helping and not hurting?
Senator, the policies that I announced now a couple of weeks back don't reduce funding for health care by a single dollar. Not $1. There was not a budgetary announcement in there. Every single dollar that was program spent, appropriated, will continue to be program spent and appropriated. What I was seeking to do was close loopholes in the policy that were permitting end runs around the Mexico City policy that prevents taxpayer dollars from going to abortion-related services. That's the mission set, while doing so in a way that preserves all of the resources that are there for health care.
But in fact, that hasn't been the outcome.
Nope.
And as you point out, you are, as the Secretary of State, focused on outcomes, and the outcomes of this expanded policy is very clear. It's shown up in every independent study that has looked at what the impact of the policy is. Thank you, Mr. Chairman.
Senator Blunt.